Okay, 5:30 p.m. the Board of Health Easthampton meeting, September 8th, 2021. I motion to open the meeting.
I second.
All in favor, Maggie, yes.
Amy, yes.
Okay. So I'm just going to mention a couple of things before we go to public speak time. Welcome to the Board of Health meeting for September 8th, 2021. In accordance with Mass General Law, we're required to tell you that this meeting is being recorded. No one else should be recording this meeting without our knowledge. We're going to proceed to public comment where anyone in the public can speak to us. We will not respond, but we'll listen. You'll have and consider your topic or concern for a future meeting. You'll have 3 to 5 minutes to speak if you choose to. Is there anyone here that would like to participate in public comment? And when you do, please say your name and put yourself on video if possible. Nope. Okay. So first item on our agenda is to approve the minutes for June 23rd, August 4th, and August 30th. Amy, did you have any questions or concerns about the minutes?
Can't unmute my, oh, there we go. It was saying I can't unmute myself. So now I am. No, I can make a motion to approve the first two, the June and
August 4th.
yes,
Right.
June and August 4th. I wasn't at the August 31st meeting, so I'll make a motion to approve the June and August 4th minutes.
I second that motion. All in favor?
Amy, aye.
Maggie, yes. Please, Jackie, can you record that Beth is not in attendance? So we'll have to postpone the August 30th approval for the next meeting because she's not here.
Well, if she comes late, can we do it?
We'll go back to it, sure.
Just to get it.
Get it off the, yeah. Okay, so the next item is our continued hearing request for 359 Main Street, the Hampton East condominium variance request for irrigation wells. You unmute, Mr. O'Neill.
Yes. I'm gonna unmute everyone here that I know that is gonna speak.
Okay.
Because I know you guys aren't gonna Zoom bomb us. Anyone else, just raise your hand or get my attention somehow.
Go ahead, Mr. O'Neill.
Thank you. Good evening, Madam Chairwoman and members of the board. This is a continuation of the August 4th hearing. It's an application for 2 wells for irrigation only to provide irrigation for 13 acres of lawn, not for potable water and not for drinking water. Complies with all setbacks. It will involve drilling down with the steel drill to bedrock 120 feet. It won't draw any water above bedrock. Will not introduce any contaminants to the aquifer or involve any activities that hurt the aquifer. This is a large amount of water that is necessary in order to water the property, 13 acres of lawn, which is a large expense for the residents, most of whom are senior citizens on fixed incomes. There is no separate water system available for irrigation wells only. The only, the variance, the provision of the regulations that says that one can get a variance says a variance can be allowed if connection to the water supply, public water supply, is not feasible. Now, feasible is a very loose term, very vague term. In our letter, we've indicated that the thesaurus indicates that synonyms for feasible include practicable or expedient. It can mean a wide number of things. So where it's not practicable and not expedient, this falls into that same category, and therefore it should be allowed, particularly since it's not going to harm anything. It's not going to harm anything with respect to the public water supply. the purpose of the regulations is to serve the public water supply. This actually would assist the public water supply. It certainly won't harm it and probably would help it because it will not involve drawing down of the public.
Oops, he got muted.
You muted yourself.
You're muted, Miss. Oh, there you are.
There you go.
Okay. I was just saying that this is going to not harm the public water supply, and it probably would help it because it would eliminate the large drawdown that would be necessary from the public water supply in order to provide all the irrigation for these 13 acres of lawn. So we submit that these circumstances are entirely appropriate for allowance of the variance and allowing this application to be approved. Thank you.
So I have a couple of questions, or well, it was an observation. I just want to make sure I'm correct. So in the letter that you sent, you said there's an average of $35,000 per year over the last 3 years for water and sewer.
Yes. Yes.
So, and there's approximately 60 residents.
Yes.
So if my math is correct, that worked out to be approximately $50 a month that they pay per year.
Well, these people are senior citizens and they're on fixed incomes, and so $35,000 per year. That would be about it is a significant expense for the trust, for the condominium, for these people who are on fixed income.
Okay, I just wanted to make sure I had that correct.
Maggie, we do have the DPW director and
Yep.
water quality programs, Mike Serwick, I think that's your title. And Amy too, if you want to speak. I don't want to cut you
Right.
off, but I just want to make sure that we
So I did want Greg to
give
weigh
Greg
in.
and Mike a chance.
Yeah, I did want Greg and Mike to weigh in on the.
Absolutely. Is now a good time? I mean, I think before we get into too much of the financial implications of their, desire to have a green lawn, we need to talk about the public health and what we as public water suppliers do to protect the aquifer. And I wrote up a quick letter earlier today. And I'll take a minute to read that if you don't mind, and then go into a couple other things Mike and I discussed about the amount of water they're using over there to irrigate their property. So it's okay. I'll get started with the letter I put together. The City of Easthampton Department of Public Works opposes the Hampton East Condominium Association's request for a variance of public health regulations in order to install an irrigation well. As licensed operators of the City of Easthampton public water system, we have a responsibility to protect our source water to help ensure a plentiful and safe water supply for Easthampton for years to come. Activity occurring over our source water and within the aquifer recharge area has the potential to affect water quality. The City of Westfield, which relies heavily on the Barnes Aquifer for its water supply, has been forced in recent years to spend millions of dollars to remove dangerous contaminants that showed up in its source water. These contaminants were found to have come from foam used for firefighting at Barnes Airport. Easthampton has been fortunate in that this contamination has not been detected at dangerous levels in our wells as of yet. In the 1990s, however, Easthampton was not as fortunate and had to spend $2.5 million, and that's 1990s dollars. Should another contaminant come up today, I mean, you could take 2.5 million in construction costs from 1990 and put it to 2021, and you're looking at a substantially higher amount of money to deal with contamination of our source water. Nevertheless, the city had to do that in the 90s to build a treatment facility to remove TCE, which is a known carcinogen. TCA contamination was able to make its way into the aquifer after waste oil was used for dust control on a dirt driveway in the 1950s. No one thought that firefighting foam at Barnes and oil used for dust control would get down and harm the public water supply. However, it did. And we talk about putting in an irrigation well for a green lawn. Has there been any discussion of what types of chemicals Hampton East Condo Association intends to use to maintain the green lawn other than just water. I mean, people put all different types of fertilizers on their lawns, and any of that will be put down in the area that these wells are. And what effect will that have on water in the Barnes Aquifer that we count on as a community for the 17,000 plus people that live here? In 2014, when this request was last brought forward by Hampton East, it was made clear that the Board of Health cannot grant a variance based on financial considerations. And this request has been made entirely for financial reasons. Letters written by my predecessor, this is in the packet that I gave to Bree earlier for the minutes for tonight's meeting. There was a letter written by my predecessor, Joseph Pachimsky, who was the then Director of Public Works, and then City Engineer James Gracia, that highlighted several reasons that this request was denied 7 years ago. And over the last 18 months, we've seen firsthand the importance of public health regulations and their ability to help keep all of us safe. And 2021 is really no time to begin circumventing public health regulations in the interest of saving money with the overall goal of establishing a green lawn. I, as the Director of Public Works, respectfully ask the Easthampton Board of Health to act in accordance with its duty to protect the public health of Easthampton's residents and deny Hampton East's request for this variance. That's really all I have for right now. Mike had a little bit more on some of the scientific aspects and the way the aquifer flows, and Mass DEP well regulations and impacts on the aquifer from other uses. So I don't know if Mike, if you want to weigh in a little bit.
Yeah, I also drew up a letter. I don't know if Bree got a copy of that. Yes, I can read it briefly here, kind of summarize it. I'm a former chair of the Barnes Aquifer Protection Advisory Committee and dealt with this the first time around. I've been a longtime employee of the Easthampton Water Department, and one of my duties here is basically groundwater protection and water supply protection. And being so, I believe that it's in the interest of avoiding contamination of the drinking water supply and preserving the municipal supply. Irrigation wells shouldn't continue to be prohibited in the Barnes Aquifer that serves Easthampton. There are three major reasons. Number one, an irrigation well is a direct connection from the surface to the aquifer, and as such, it represents a potential pathway for contamination. Backflow from the irrigation system could contaminate the aquifer with chemical fertilizers, pesticides, and other contaminants. Withdrawals from irrigation wells will create cones of depression that could alter the groundwater flow system in such a way as to change the path of existing contaminant plumes. Such changes could also lead to contamination of municipal wells. For example, the plume of TCE that Greg was referring to earlier, moving from Southampton into the Hendrick Street well field, where it is removed by treatment, could be induced to flow towards Brook Street or Nonotuck wells, which do not have any treatment, thus following those pristine supplies. Also, under the state's relatively new sustainable water management initiative, under those definitions, the groundwater withdrawals, if they take into consideration what the Hampton East wants to withdraw, we're already basically getting close to what our maximum allowable limit. Allowing more water to be withdrawn for irrigation could affect the amount of water that's available for usage by the Easthampton residents. So basically, you could, not helping our water supply, but actually hindering us by taking that water for basically watering the lawns. As you may or may not know, the US EPA designated the aquifer in Easthampton and Southampton as a sole source aquifer in 1995. These two communities rely entirely on this source for their drinking water. If contamination were to occur, they could pose a significant public hazard and a serious financial burden to the communities within the aquifer service area. The EPA has noted that designated area is a stratified drift aquifer consisting of shallow sand and gravel deposits. The shallow nature of the aquifer allows contaminants to be rapidly introduced into the groundwater with minimal assimilation. I hope that you take these points that I made into consideration when you vote to either allow or disallow this variance.
And if I could add for a minute here, I pulled the usage history for the Hampton East Condo Association, how much water they've used. And I just want to take a minute to put the amount of water that they're putting down on their landscape into numbers that are a little easier to understand. So I'm just looking at the time period from July 13th of 2020 to October 19th of 2020. And we can call that like a 90-day period. We read quarterly every 3 months, so it's about 90 days, right? So in that 90-day period, they used 226,750 cubic feet of water to irrigate their grounds. So you take that 226,000. I mean, I encourage anyone to do this if you have a phone or calculator right there. 226,750, right? Times 7.48, which is their 7.48 gallons in a cubic foot of water. Equal that out. We're talking about 1.696.090 million gallons of water. So just shy of 1.7 million gallons of water pulled out of our aquifer and onto their grounds. Mind you, they've paid their water bill. I mean, we have the supply. We can sell it to them if they want to use it. But I think it would be a much wiser decision for Hampton East condominiums to look at a more sustainable way rather than just a less expensive way. Can their irrigation system be fine-tuned, optimized, ran less? Would the lawn have been fine if they only pulled? I mean, so take that math I just did, right? 1.696 million gallons of water. Divide that by 90 days. Right, what do you get? 18,850 gallons per day. That's a residential swimming pool, right? Like a 24-foot, 4 or 5 foot deep swimming pool holds about 13,000 gallons of water. So they've taken a swimming pool and a half every day over a 90-day period and sprayed it out on the lawn. Now, hey, who doesn't want to have a nice green lawn? I get that. But we're looking at this from a financial perspective on behalf of, an older population that lives there. They could probably save themselves a lot of money by finding a more sustainable way to do what they're doing. I just think, when you hear it in those terms, 18,000 gallons of water a day on the lawn. I mean, we're very, very fortunate here in New England and in Easthampton, particularly to have the water supply that we have. I mean, you look at Western parts of this country where there is, water is scarce, and we're fortunate that we have it. But I think there's ways to be more responsible with it.
Well, Maggie, Mr. O'Neill has his hand up.
Yes, I'd like to respond to any comments. Thank you for your comments. Now, with respect to the chemical contamination, PFAS, we've heard about PFAS as a recently has come to be a problem recently, and that is associated with fire protection in airports in particular. It's nothing like that going on here. Also, TCE, which is a commonly associated with industrial uses, frequently gas stations, nothing like that here. Now, this particular proposal proposes drilling down with a steel drill 120 feet to bedrock, not drawing any water above bedrock, will not introduce any contaminants into the aquifer, and it's not going to involve any activities that would harm the aquifer.
So, Mr. O'Neill, if I could ask you just one question.
Yes.
Can you guarantee to me that no one will ever store a bag of fertilizer in a well building over there that could accidentally be spilled on the floor and end up with a ton of nitrate ending up down in that well? Can you guarantee that?
Well, I don't.
Just the way you're saying it, I'm just curious. Like, is that something that Hampton East condos can guarantee? 'Cause I'm just not. I don't think that it is.
What I'm saying is that the application that they are making is to provide a irrigation well for the purpose of watering their lawn. They're not proposing any fertilization of their lawn. They're not.
Do you have a list of any fertilizers they currently use on the grounds? Any and all, whether it be for lawn, plants, anything? Do you have a list that they use? Do they have a company that?
I don't have that list.
All right.
I don't have that list.
I think at this point, Mr. O'Neill, we've heard your variance request, and I'm sufficiently swayed by the two, skilled, qualified people who we've heard today that says that this is not a good idea for a variety of reasons. We have a regulation. That regulation was made in collaboration with the skilled professionals that we also employ in the town of Easthampton to help us make these decisions. Now, I am not a specialist in water, but these guys are. And so if we're, Maggie, I don't know where you're at, but I would like to make a motion to deny the request for variance at this point.
I agree. I second that motion. All in favor?
Amy, aye.
Maggie, aye.
Beth is here.
Oh,
Let me unmute if she wants to.
I think, should she abstain since she wasn't here for the entire presentation?
yeah, I
That's what I was thinking.
think,
So I think Beth's vote should be abstain.
thanks.
Yep,
Amy.
that's fair.
So Jackie, that's Amy for, Maggie, yes,
Yep.
Beth abstain, 2-0-1.
Yep.
Okay,
Thank you all very much. The people that work here and run this public water system work very hard to maintain it and keep it safe for the people that live here. And I greatly appreciate your support.
yes, thank you for coming tonight and helping us understand this better than I think we did when we
Yeah.
started this meeting.
Exactly. Yep. Thank you both.
Okay, have a good night, everyone.
You too.
Thanks, Greg.
Okay. Oh, so do I have to officially close the hearing then? I guess so, right?
Yes.
So just make a motion to close it.
Yep.
I make a motion to close the public hearing for the East Hampton Condo Association request for wells at 5:52 p.m., 9/8/21.
Amy, second.
Maggie, yes?
Yes.
I'm going to abstain, I guess, because I wasn't here for the whole thing.
Thank you, Beth. Okay.
I just texted Owen. He'll be here in a second. So if we want to go back to maybe
The minutes.
approve the minutes on,
Wait.
I have August 30th. Was it August 31st? I think it was a Tuesday.
It was a Tuesday.
We had that meeting, so my agenda might be, okay.
What is,
Okay, so my agenda's wrong, but we are approving the August 31st meeting minutes that I did earlier. Beth, we just needed you to be involved because Amy wasn't at that meeting, so we just need you to, did you get the minutes earlier?
I did. I really quickly scanned them. I have no objections to the minutes.
okay, so you want to make a motion to approve?
Sure, I make a motion to approve the minutes from the August 27th meeting. Is that what it was?
31st.
31st, sorry. August 31st meeting.
I second the motion. All in favor, Maggie, yes.
Beth, yes.
Okay, good. Okay.
Oh, Owen's here. Let me just admit.
Yes, okay, good timing.
Okay.
Hey, Bree,
Hey, Owen.
and whoever else is here. I apologize. I'm in a precarious situation in terms of video.
Okay. So on the agenda, there's a discussion for the prohibition of single-use plastic bags and disposable food containers and straws. Did you want to, I think we had some questions about,
Yeah, I can start, Maggie.
yep,
Hi, Owen.
Hey,
It's Amy. I I read through it and I did have questions that were specifically relative to each section numbers that I laid out, but then I left that where I was doing the work to write it. So I apologize, I don't have the specific reference numbers, but my biggest concern is that the Board of Health will hear requests for, what's the word that was used in the deferment. Yeah, I think that kind of puts us in we, as you probably have seen, we sometimes have situations with these types of establishments that we would like to continue to have as positive relationship as possible, and to put us in that situation, it kind of might shoot us in the leg moving forward with that type of business. So is there another way that we might be able to work on deferment or take deferment out and just, I mean, other communities don't have a deferment process as far as I know.
I guess my only concern, and the reason we put deferment in is, I guess, so what happens if a business needs a certain product, let's just say a container, and there's just no available substitute. And so that's why we consider deferment. So for instance, as an example, a business came to us that relies substantially on condiment cups. And frankly, I hadn't done any research, and I don't know if they had either at that time, but if they have a certain product that's really pivotal to their functioning as a business in the delivery of their food, if there's nothing available that meets the needs of the ordinance, we wanted to include a deferment process so that people could basically say, hey, I use this container, there's nothing available for it like it that's non-compostable. Here's a documentation basically of the search I did, and I'd like to have this item exempted I'd like to be exempted from enforcement for this item, basically.
Bree, do you know what the other communities do in situations like that? I mean, do they, because instead of requesting a deferment in advance, could it be something that's, we find it, they say, then we deal with it kind of one-on-one, where the inspectors have the authority to just, make those decisions like they would in any other code that they're enforcing on site?
Yeah, and also in the document, it says compliance with any section of this ordinance would cause significant economic difficulty, and then there's no really available compliance substitute. So my concern is the looseness of the economic impact, because, that could be all over the map from one establishment to another.
I think one of the points that Maggie or Amy made, which was kind of compelling to me, and I think I relayed this to you, is right now with everything going on COVID wise, someone could say that $10 a month is a hardship. And I think the board was just nervous about having to pick and choose what $10 is to one restaurant might be, or vice versa, $50. So that was just an example that someone brought up. I've reached out to as many towns that I could think of that had it. When I worked in Greenfield, we didn't have a deferment process, but the ordinance was a little bit different. It was just a ban of styrofoam. It wasn't as in-depth as this one. The only person that responded to me was Jean in West Springfield. And she said, the board deferred everyone until 60 days after the end of the emergency. This is next month. Oh, after the COVID emergency. So she said, so far one business has asked to go to the board. So that's the only information she had. So I didn't really get much. I think I reached out to Northampton, Chicopee, kind of like the bigger cities.
So that's my other thought as well. I mean, I know that there's, always I guess I'll answer all the questions. I don't know in specific order. And then I'll also just say, obviously, I'm open to, you're the experts on this and this is what you deal with. So if there's suggestions about how to edit this or remove it or change it, I'm definitely interested in hearing that. So I don't the first thing I would say is, I mean, I guess you probably know better than I do, but I don't know, like, for instance, how many businesses are going to ask for deferments. Like, a lot of businesses are already pretty close to being in compliance with this ordinance. And then in terms of the economic hardship, that's a great question. I think the goal is progress. So the goal is to reduce our plastics use and single-use plastics, and not to be draconian. We're here to work with small businesses, which for the most part, all of our food serving businesses are, with the exception of franchised chains, and even some of those I'm assuming have local owners. I don't know their franchise structures. So it's more about a show of goodwill than any hard and set rules. So in terms of not being able to be in compliance, I think my response to Amy is probably the best one I have right now, just being able to give examples of items that they're utilizing that just don't have sufficient substitutes. And then in terms of the economic hardship, I think I would just say that I would expect businesses just to put some effort forward to demonstrate that hardship. In other words, here's what we're spending now, here's what we'd have to spend in order to come into compliance. I don't know if there needs to be any number as much as just to demonstrate that there's a difference, and to say, at this time, it creates a hardship for us. My suspicion is that there's not going to be a lot of businesses that would be doing this, but I just don't know. And I guess the other question too is, I know we just delayed the implementation of this, should we wait until the pandemic's over? Although I don't know if that will make a huge difference, but, or should we just strike the section? Is there, I forget who mentioned it on the call already, but should we just make it a case-by-case issue? And if there's a complaint and enforcement, then there's some sort of mechanism to the Board of Health where they can make a decision.
Yeah, I mean, so Owen, this is Amy. It's tough in the field of regulatory enforcement to have something that we enforce sometimes and don't enforce others, because it sets us up to look like we're playing favorites, but also it sets our inspectors up for a really kind of awkward situation while they're in these restaurants. So I think, it would be my preference to probably strike this deferment and then allow them to use the avenues that we typically have in other code enforcements if they feel like this is, what's the word, arbitrary and capricious. Right? Like I would rather replace that with the terminology that's, if we're going to be the enforcers and the people that they go to replace it with terminology that our health director and our inspectors are already very familiar with in all the other codes. Or if we leave this, maybe can the city council be responsible for being the people who give passes on this?
Yeah, but we're not an enforcement body, so I don't think that would work. But I'd be open to adapting language that you think would work for the health department. So can you tell me a little bit more about some of the language you were kind of, suggesting that is kind of used with enforcing other codes?
Yeah, Bree, what comes off the top of your head? So I know all our regulations and codes have to not be arbitrary and capricious, right? We can't say everyone needs to have refrigerators that, can ping you on your cell phone if they drop below 45 degrees, right? That would be an arbitrary and capricious regulation. It has no real basis in reality. And people could come to us, should we pass a regulation, and say, hey, we really, like we just had a hearing on it, right? Like, so the well people were saying that our regulation was arbitrary and capricious. So they asked for a hearing to discuss that. And at the end of the day, we denied their request, and we said, there's a variety of reasons that this is not arbitrary and capricious, and what will come of that next, we don't know. But that would allow the inspectors on site to try to enforce, try to problem solve like they do with all of the other regulations that they have to enforce, work with them to find an acceptable solution. And then if the inspector and the business can't come up with a solution that they agree to, they would come to us for an appeals process. And then at the end of the day, they're not looking for a deferment. They're asking, do I meet this regulation with this? Or can I have 6 months instead of the 1 month they gave me? Or no, I'm sorry, this is something that you have to meet.
Yeah, and I would prefer to take any language out about economics.
Yeah.
It's a real setup for the inspectors to run into problems and for the board too. So I agree with Amy's summarization of how it should be a general statement, not specific to certain things.
And I should start with the director and the inspector. They handle all of these things. The only ones that we see are the ones that they can't come to an agreement on.
Right.
And they're great. They're agents of us. They make the right call. I mean, we have no problem with that.
Right.
I would add two things. One, I agree, maybe the economic thing we take out. I think the part, Owen, where you said if there's no other alternative, that makes sense. But I think like the economic hardship, I think we're going to be, that's never kind of like our thing in public health. We never take, economics into consideration.
Right.
The other thing is too, like we're used to enforcing things that we're really confident on. 9 times out of 10, I know the answer right away and I'm confident in that. With this, I just get nervous because if someone comes and says like, it's an extra $50 a month, that's expensive. Like I'm going to hem and haw over that for hours. I'm not going to really know the answer. But when we have like a variance request for our well, and it's like, I know the answer to that. Or right now, our health inspector is finding a lot of tube-based sinks at restaurants. I know that those aren't allowed and I know like how to deal with those. This just made me nervous. And we've talked about this offline. It just makes me nervous because I don't want to be stuck in a place where we aren't confident in what decision we're making and we're making decisions that aren't really based on like the environment or public health. So I agree with like the economic thing. I don't think like the deferment thing is total loss. I don't know if we necessarily need to strike it completely. I think maybe we redo the language and we just, like that restaurant you said that relies on those small condiment cups. If they're like, listen, there's no alternative. We've looked everywhere and they could prove that to us. That's kind of an easy one, but I think the ones where, based on what we've seen recently, like we're not having a super easy time out in the field right now. So it's, it's just, I guess, nerve-wracking in a sense, if that makes sense.
Yeah. I would agree with that. I think there should be what you just said, Bree, and it is good to have so that people know that if they can't find the alternative, they're not going to be cited or something like that.
Mm-hmm.
But
yeah, and I think we can leave that up to the department.
Yep.
Yeah, so maybe we can keep it like a normal kind of situation where Brian and I handle it on the local level, and then if we get to a point where we feel we need assistance from the board, that can be our next.
Yeah. So Bree, do you want to work with Owen to adjust that to be to take out the deferment and add a variance request should the same we have for any fines or things that you levy, they within 7 days of notification, they have the right to appeal to the Board of Health for a hearing. And if we add that same language, it's really consistent and people will know kind of what the process is, and then we either uphold it or not based on the information we're provided.
Yeah. Yes.
Does that sound agreeable to you? Because I think this is a fantastic idea. I probably should have started with that.
yes,
But
Ellen, we salute you and the council for.
Yeah, it's fantastic to be this progressive and really doing our part because, as we just heard in the well, hearing, the environment is going to be the next public health crisis for us. And this is a great proactive step that we're making. It's so I should have started there.
Owen is on mute.
Oh, sorry. Oh, and we have to mute everybody because we get Zoom bombed all the time.
No, I understand. And I tried to unmute myself and then I figured you would figure out that you had to unmute me. So yeah, so first of all, thank you. No, and I want to be clear, sometimes also, we write these ordinances and then Bree and I spoke a little bit, but sometimes you also don't know exactly what's not going to work until you start passing it around. So I really appreciate the feedback from this body, from the professionals who say, yeah, good idea, but that's not exactly how it works. So what I would ask then, I think it's echo what Amy said is, so we have a narrow timeline, but not super narrow. Do you think we can tweak the language a little bit and come up with something that's more amenable to kind of the scope and the actions of the Board of Health, and so that I could propose it to the council and we can get it reviewed and a public hearing before the first of the year?
Oh yeah, I think the language we have will probably just mimic all of the other things that we have. And I think if Maggie and Beth are okay with it, Bree and I could pump something like that out in the next week. If we all agree that that's the only part of this that needs to change, that's not going to take us long at all. Bree, and I don't know where you're at. And I said a week, and I feel like your whole body slumped. Maybe 2 weeks, Owen.
So I guess the only thing I'd say is the next, I would, if possible, and I totally understand schedule crunches. And if I could get it in for the next agenda so it can get moved to ordinance, we could discuss it. That way we can get a hearing, like, let's say for like November and get it done. That would be awesome.
So when's your next meeting?
So our next meeting would normally be next Wednesday, but it's moved a week because of the Jewish holiday. So next Thursday would be our deadline for agenda submissions. Do you think that's achievable? I guess I could try to. The other option would be the first weekend in October, which I think would still work too. I don't want to put anyone in a crunch here.
I think I can pull a couple of our regulations and put some language together based off of even our well regulation, that has variances, our body art. We can take language from all of our regs, and
It's about
I can do something. Yeah.
But is that
So just to be clear,
that you can get it done by next Thursday, Bree?
I think so, because it's just that one section. We're just writing a variance.
Yeah, we'll
section.
strike deferment and turn it into a variance.
I just want to be clear though, we're just striking deferment, and for enforcement, when we had it in Greenfield, I think in the beginning there was a little bit of confusion and calls and stuff, but we didn't really get a lot of complaints. I feel okay enforcing it. I don't know if the board has any thoughts on that, but I think we can keep the penalties and enforcement section in.
Yeah.
Because our inspector is out in the establishments anyway, and that can just be another thing that we look for, is to make sure that they don't.
Yeah.
And to be honest with you, in Greenfield, nobody purposely wasn't following it. I found one person with styrofoam, and they weren't doing it on
I
purpose.
think as long as you
So,
feel confident you have the capacity with the staff you have to do what this is asking you to do, I don't have any problem with it.
Yeah, if it does for some reason get to an extreme point, where we're getting pulled, I don't think we will, but I'll just, Owen, I'll come for you.
And I will, I'll own up to my mistakes and we'll figure it out.
We'll just clone Brian, that's all.
Yeah.
No, but I do appreciate, obviously these things need to work for the enforcement bodies as well. So I appreciate your flexibility and collaboration trying to mold this into something that's workable.
Great. Yeah, we're always happy to collaborate. So anytime you need something, you let us know.
Cool.
And and you still want to make this effective January 1, because our permit renewals go out in October, and I was planning on sending a lot of this information then. I don't think we'll be able to do that. And I have probably 90% of our establishment's emails, but some of those emails go to like a place in Texas where their permits get renewed. So I just don't want to blindside. I know that this has been like on the city agenda for probably years at this point, but I don't want restaurants to feel like they have 2 months to comply. Am I understanding that correctly? Or would it be 1 year from the date?
It would go into effect. I'd have to look more closely at the language. I think that they would have, I have to look. It would go into
I have
effect.
it. It says January 1, 2022.
Yeah, we just changed that.
Oh, so later, to like, do you know roughly how far out?
That's the most recent one I have from August 12th, 2021 from Barbara. She sent out
Yeah, we just changed that the last meeting because it was initially going to be October. That was going to be like next month. I mean, I could, well, I guess we could do a couple things. Maybe let me look at the language really quickly. I can't remember even now if like basically we gave a grace period. Because I think there's language in there that basically says that businesses can use up their existing inventory.
That's what I thought. You had something along the lines. But yeah, we'll talk about that. I just don't want to send out like an email like December 1st and be like, you have a month to comply, because it's been a tough 1.5 years for these establishments, and I don't want to just keep kind of piling it on everyone.
Totally.
So.
I mean, we just moved that date. I guess I feel comfortable if we have to change it again, to change it one more time. I just don't want the council to stop inviting me to meetings. So let me look it over, Bree. Maybe you and I could talk offline. We could figure out the best solution to make this, a non-onerous issue for the council, and then we'll shore up that language. And if there's a change in either the date that goes into effect or some like little tweak, like businesses have 90 days or whatever to come into compliance, after the date of effect, if we want to slip that in there, maybe we'll just have a quick talk, sometime next few days or something.
Yeah, that's really fine. We'll talk early next week anyway about that variance language.
Okay.
So.
Okay, wonderful. I have to jump off. I apologize. Are there any other questions? I'm sorry that I'm kind of like I'm off video. I kind of jumped in and out.
Hey, Owen.
No, we're good. We're good.
Yep. I think, Beth, do you have any other questions?
No, hi, Owen.
Hey.
I'm sorry I've been so quiet. I have no other questions, and I agree with altering the language and everything we've discussed. So
The other thing I'll leave for this body too is there was a recent discussion in City Council about straws, and we struck the language that was in there so that we could do a little bit more research about the effects of straw. I don't want to say a ban because we didn't have a ban previously, but just make sure that we really researched all the avenues, how these things affect people with disabilities. So it's actually available in the City Council packet, but I can also distribute it to, I could send it to Bree, who can send it to this body. I did some extensive research and interviews with a number of disability advocacy groups and individuals. And I got feedback there, and we came up with language that we felt, or I would say those individuals felt would be acceptable. So I could send that to you all because that's in discussion in City Council and committee. Again, just trying to be good environmental stewards, but at the same time, plastic straws specifically really are an accessibility issue. So we're going to be hopefully shoring up that language.
great.
Okay. Great. Thanks, Owen.
Yeah, no, thank you. Thank you for all the work you do. I mean, especially, I really just want to express my gratitude to how hard this body and the director has worked during the pandemic. I mean, you've done many, many, many years and hours worth of work in the matter of 18 months and taken a lot of guff. I don't know if this is NC-17 or M rated, but I really appreciate the work you've done in under a lot of duress and making some really hard decisions, but following science and taking care of our residents here in Easthampton. So thank you very much.
Thanks.
Ellen.
Thanks, Owen.
All right, I got to sign off, and Bree, will talk soon.
Yes, thank you.
Okay, thanks everyone.
Bye.
Bye.
So we did skip over Sam Coach,
So, yeah, did we,
owner of Mission Taco. He's not coming. Yeah. He was unable to make this time. So I told him, I invited him to our October meeting. I have yet to hear back. I sent you guys my responses and Megan Harvey's responses to his email. It's up to you. I don't know if you want to send the response now or if you'd rather address it at a Board of Health meeting. It's up to you. I don't
just send it? I mean, I don't
get into it over email.
Clear on what
Yeah.
he's asking except to reverse the mandate, which.
Well, I guess Amherst adjusted it in a way that worked out better. And I called Amherst last week and they weren't really sure what I was talking about, but then they called me back and I was never able to reconnect with them. I don't really know how our mask mandate could be adjusted. And I'm just saying, like, I'll talk to Amherst as soon as I can, but masks are required when you enter the establishment, but they can be taken down while seated. So I don't really know how we could adjust that.
Yeah, and most of their clientele is outside.
Mhm.
So, I don't know.
So if you guys are in approval, I'll send my responses to him, but I don't want to continue going back and forth via email. So I think if he responds again, I'll say, I really want the board to be involved. Like, I don't want to get into like a back and forth email trail. So.
Yep.
So you did respond once to him and gave him all of the, CDC links and stuff that we accessed, correct? So you're talking about the response to his second email.
Yes.
Okay.
Which I don't know.
Because I was just gonna say, like, I mean,
No,
go ahead.
go ahead. I don't know if that was like a true records request. So I don't know if that's something that requires a response for me. That's my style, is to respond to
Okay.
everything. So I don't think there's any harm in responding, but I just wanted him to come to the Board of Health because it is a Board of Health regulation. And, if kind of like more than a couple emails back and forth, clearly I think it should come to the board at that point. So I'll send my
Right.
responses and.
And Megan's are on there, right? This one?
Yeah.
Yeah. So I think, what else, I don't.
Well said.
All right. Our next meeting is the first week of October, the Tuesday. I think it's a Tuesday, October 5th at 5:30. So
Okay.
10:05. Megan Harvey, who's contracting with us, did her first dashboard and it came out really well. So I'm grateful to have her on board. She's a plethora of knowledge. So I feel grateful to have her. And I'm going to be meeting with the mayor on Monday to strategize ways to recruit a public health nurse, because the CTC is actually,
Raise the salary.
they ramped. It's in my, it's in my notes.
Should
to
have
do.
talked to Owen about
But-
that while we had him. Appropriate
I know.
more money.
Yeah.
Well, and then, a colleague of mine recommended maybe making it a contracted position because she just interviewed 6 nurses and none of them needed the benefits. I thought that the benefits would be attractive, but maybe that's not what people are looking for right now. So maybe we make it a contracted position. I'm going to talk with the mayor on Monday. South Hadley reached out and expressed interest in maybe sharing a 20-hour and a 20-hour nurse to make it full-time. So right now I'm sending cases to the CTC. I think they're actually doing a pretty good job. They're responding quickly, but we need somebody in-house to assist me with data collection, schools, our school COVID task force that I'm on. Amy was just such a huge resource that I didn't even know that we needed until we had her. So we're feeling that loss right now. So, and besides just regular contact tracing, which is, yeah.
If you do end up sharing a nurse with Southampton, Hadley, sorry.
Yeah.
There is money available to fund that because the state is really pushing shared services. So they did just close a round of nursing nursing incentives, and they're reopening shared services, and nurses will be considered under that. So you might be able to get more than just a 20-hour a week nurse if you approach it with them and consider it a shared service arrangement.
Okay, perfect. Do you know when that's?
I would send an email to
announced
Erica Piedad. Well, I would confirm with Sharon Hart that she wants to do this and if she's interested in applying for the money. If she is, then I would reach out to Erica Piedad, let her know that that's an arrangement that you're considering and that funding would really support that initiative. Kind of leave it open-ended and ask her when's the next round opening for that, because I believe it's coming up, and the application is so easy because they really want people to do this. It is like I've never seen an easier grant application in my life.
Those are the ones that I like.
Yeah, it is incredibly easy. And this is where the state is going. And I think the mayor has expressed a lot of support for, moving in this direction in certain realms. And I think we will get her support for something like this.
Oh, yeah.
Even if it's, we get a 30-hour a week nurse and we fund the epidemiologist, some of the epi after that grant runs out. Like, we can really be creative with this. So if Sharon is in, we can really strategize where we might want to spend this money. So reach out to Erica Piedad and say, hey, when is this open? We're really interested in applying. And because I know some of the communities that already have it are being thrown more money. And there's another round coming after that for communities that are given the next round. I mean, there's money. They're just like throwing it. Let's be getting it.
Grab it.
Perfect. Thank you.
Boy, Amy, you're a resource of money. That's good.
The CTC is doing a good job of contact tracing, but we don't just deal with contact tracing on the daily. We get a lot of questions and technical assistance. We've got clusters and things happening where it's not just a matter of like sending our cases to the CTC. So that nurse is, and the mayor expressed today at our department head meeting that is really her priority, that position. It's insane to me that we've had no applicants in 2 months. I know we pay about $7 less an hour than neighboring towns. So, and that's maxed out.
Well, there you go.
Well, isn't it really funny? It was really funny. They cut those hours and we said, hey, if anything happens, we're going to be really SOL. And everyone said, yeah, no, that's not going to happen. And then you know what happened in less than 6 months?
Here we are.
Who didn't knock on wood? Someone didn't knock on wood.
I think it was Maggie.
I've gotten 2 emails saying there's a public health nurse position open in the city of Easthampton, if you're interested.
Are you?
No, you better not take it because we need you here.
Yeah.
Yeah, well, I wouldn't know anything about half the stuff they do. So
I think we are in a good situation to get some funding to take care of this and really create a sustainable position in Easthampton.
Yeah, definitely. And even after COVID, it's not just for COVID. I mean, we need it with everything, with ticks, mosquitoes, all the type of outreach that we could be doing.
Well, if you think also about where the state is going and where the funds are going, right? They want communities who are delivering health services that are taking the fundamental public health crises and making them better. And how do you can't do that unless you have someone who's saying, hey, how's our childhood asthma rating? How's our lead rate? How's, fetal maternal health. And you have to look at the data, and that this position isn't just for COVID, right? Once the pandemic's gone, there's still other things that this position can work on. And that's what we need to help people understand, because I don't think they do. The pandemic is something that is very in their eyes, but when you move past the pandemic and you think about how can we really elevate the health of the residents of Easthampton and what it is that they need, and let them have say in that. And I think I keep coming back to funding, but if we can start to create the framework for how we are going to be able to do that, the state is going to fund us.
Yep. You're so smart.
It's like she does this for a living or something.
I know, really.
Right? Every once in a while, something smart comes out, but.
Well, thank you guys. This was successful. We got a lot done this meeting. I'm sorry for the a million emails. I know I sent a bunch. I like to just send you guys one packet, but I just was sending you as I got things. I will be at Mill Pond Live Friday night, tabling.
Oh, you're gonna do it?
Giving out with the mayor, yeah.
Okay.
I kind of got suckered in a little bit.
What are you giving out?
I have to inspect anyone. Well, I want to set up my computer there and sign people up for vaccines. I wanted to have an actual pop-up clinic there, but Northampton's kind of they're starting to ramp up for third doses and booster shots. They don't really have a lot of capacity right now to do pop-ups, and they also didn't think that we would be very successful at that population at Mill Pond Live. So it's a lot of work for them, and for them to give out 4 shots, even though 4 shots is great. So anyway, I was hoping to just give out vaccine information, help people sign up for the vaccine if they want, and we're just going to be giving out.
But, the more I heard
public health stuff. So
I heard from one of the nurses on my team today that most of the people being hospitalized with a Delta variant are there's a lot of non-vaccinated people still, and they're the ones. So the more we can promote.
Yeah, it's 99.8 of the population that is being hospitalized right now is unvaccinated. It's 0.16, I think is the number today.
It's ridiculous.
And, I read something, I don't know if it's the New York Times. Well, never mind. Well, actually, let's do it in case there's someone who ends up watching this at some point and is looking for data. They're really talking about if you look at the whole numbers, 100,000 people or 200,000 people, and because they're saying all these breakthrough cases, but the breakthrough cases are not actually as bad as they're being hyped up to be. And so what is happening is people are running away with this crazy figure of breakthrough cases, and then the people who are hesitant for vaccines are oh, forget it, I'm not going to get it. But if there was actually more detailed knowledge, okay, I think it was five out of every 100,000 people right now are considered a breakthrough case. That's minuscule.
I can tell you in the urgent care, the only vaccinated COVID positive patients I've taken care of personally are people who are immunocompromised. They're getting chemotherapy, or there's some underlying immune disorder that's making the vaccine not as effective for them. But
so there you go.
And what patients don't understand is that, I'm sorry, you got me going. So
it gets us all going.
But what the patients don't understand is it's not supposed to stop you from getting it. It's supposed to stop you from getting hospitalized with it, And so I have this conversation daily with my patients, oh, the vaccine doesn't work. And it's well, actually it does. The people in the hospital are not people who were vaccinated, for the most part. So anyway.
Yeah.
All right. Is there anything else that we need to?
There was a question that I wanted to ask you guys that I said I would ask you guys. I had a daycare call me and ask me, so DESE recently came out with guidance, not DESE, EEC came out with guidance and said masks are required indoors for 5 and up. So a daycare called me and said, your guidance says 2 and up. And I said, I'm 99% sure that our order would trump it, as our orders typically, whichever one is stricter. And I said, I'll run it by my board just to make sure. I just want to make sure that you guys don't, because it's EEC regs, but I think, how we normally operate is whichever is stricter. So I figured I'd throw that by you guys.
Yep.
Okay.
Yeah. I've never, like, it's always 2 and up everywhere that's what the CDC recommends. It's weird that they did 5 and up.
The state was 5 and up for some time, and then they went down to 2, and then the CDC was 2. So that's where okay.
All right, guys.
Good with that. I will copy you guys on my response to Sam, and I'll copy you on my response to the well, because we have to provide something in writing to them that we denied their variance request. So
Okay.
we'll see you in October.
Yeah, does anybody want a motion to close the meeting?
I want to apologize for being late and also make a motion to end the meeting.
I second the motion.
All in favor?
Amy, yes.
Beth, yes.
Maggie, yes.
See you guys next month.
Yeah, thank you
See you
guys.
then.